Good morning, everyone. My name is Lisa Honka, and I have a company called Your Key to Senior Living Options. I bring lots of resources to the families that I work with here in the villages. And today we are really excited to have Dr. Yvette Flores from Cora Physical Therapy joining us to speak with us about balance. And I know, again, as we age, balance becomes more and more important. And how do we stay safe, right? And that's one of the biggest things that I hear is that people have tripped, fallen, they're a little unsteady, and a lot of life medical events make us unsteady, right? Like diabetes. And so Dr. Flores is going to speak to us about that. And at the end, there'll be an opportunity to ask questions from her. So again, thank you everyone for joining us. And Dr. Flores, thank you for joining us. Go ahead and introduce yourself and tell us a little bit about Cora Therapy. And at the end, we'll have some information on how they can get in touch with Cora Therapy if they want to start therapy with you.
Sounds great. Can you hear me okay, Lisa?
I can hear you great. Thank you.
Wonderful. So thank you so much for having me. It's such an honor, and I'm so excited to be able to share this particular topic. Today is one of a three-part series. The big title is Top 3 Age-Related Changes That Make It Harder to Remain Active. And I am a physical therapy doctor of 22 years. I've actually owned my own practice for 10 years in Santa Monica, California, before coming over to the villages here in Florida. And I love it here. So I am the clinic manager for the Cora Physical Therapy clinic in the Spanish Springs location. And so we receive a lot of patients here that have either fallen and seriously injured themselves or have had multiple near falls where now the spouse is really nervous. And they bring them here, doctors refer them here so we can take a look at what's going on and really start to understand and determine the root cause of why they're beginning to show these risk signs of falls. And we've developed a really solid program of identifying that fall risk, as well as how to treat it and how to successfully improve balance. So today, like I said, is the first part of this series, and it's all about balance. So loss of balance strategies is the first one. I sincerely hope you join me when we do the second one. Because the second part will be about loss of flexibility and mobility and how that impacts one's ability to remain active and safe. And the third one is loss of core stability. And that's going to be the last part of this three-part series. But let's go ahead and jump right on in. And this is all about loss of balance strategies. Okay, so as we all know, we love the villages. It is a great opportunity for retired seniors to remain active, and there's a plethora of different amazing things that we can do here. I think the top 4 common recreational activities that we hear about here. Number 1, obviously, we know is golf. Number 2, I think it's kind of hand in hand with golf, is pickleball. And then after that, we get a lot of patients talking about bowling and talking about dancing in the square. And, these are all fun, exciting, wonderful things. And I have such a big passion to help patients as much as we can to hold on to these things, because remaining active as we continue to age is the most important thing. And we don't want to let things like balance loss stop that, or loss of strength or flexibility or core stability. So this is definitely a personal passion of mine. And I really hope that just with today's talk, you guys are going to learn a lot about what's going on and what you guys can do to be empowered and to be proactive. Okay, so these are essentially the questions that I will be answering in today's talk. We're going to define balance. What is balance? We're going to talk about what body parts, are important or are involved in our balance. There's also physiological systems that are responsible for our balance. So we're going to talk about that. Then we're going to talk about, when does balance start to decline? What are some signs? What are some symptoms? And then we're going to talk about, well, when can we tell that our balance is declining? What should we look for? And then lastly, we're going to spend some time talking about what can we do to improve balance, to prevent it from getting worse in the first place, because that is possible. But then also, if you've already experienced a loss in balance, what can we do to improve that? So let's define balance. According to the dictionary that I looked at, balance is an even distribution of weight, enabling someone or something to remain upright and steady. So obviously, we're not going to be doing these things in the pictures that I'm depicting, but I think it's kind of cool to kind of look at what they're doing to stay upright in those positions. It's an even distribution of weight. So the top picture shows someone standing on one leg, right? That person is holding on to their other foot. So how is it that they can do that without falling over? Well, that hand in front of them is a huge reason why they can do that. They're counterbalancing the weight of what's happening in that leg that they're lifting up with the weight of the arm in front of them. And then they're utilizing multiple systems and strategies in their body that they can confidently rely on to keep them upright so that they don't lose their balance. Same at the bottom. If you were to ask me, can I do that? Nope. And I won't even try. But down there, incredible strength, stability, core stability, flexibility, and all of her systems and her body parts that are required for balance are working perfectly for her to be able to do what she's doing, right? So obviously for us, we're not expecting to get to that level, but the level that we are expecting to is basic, what we should be able to do day in and day out. And that's to just be able to stand on our own 2 feet and to walk and to go up and down inclines, up and down golf courses, up and down stairs, up and down a curb without feeling like we're going to stumble and fall backwards or buckle and fall onto our knees. Okay, so we're going to jump right into it. What body parts are responsible for our balance? There's several. We like to call them body parts that have an innate strategy, because our brain and our body is designed that way. So what I mean by that is the ankles, the feet and the ankles. There's something called an ankle strategy that is a reflexive response to a loss of balance. We also have a knee strategy that is also responsible for a reflexive response to a loss of balance. And we also have the hip strategy. So when you think about that, the body is equipped with these reflexes occurring at the ankle, occurring at the knee, and occurring at the hip. So it kind of makes sense if you start developing some challenges in your feet, whether it's neuropathy, it's swelling, it's peripheral artery disease, it's stiffness, that's going to impact your ankle strategy. So now that's not going to be something you can rely on. Okay, so then let's add the knee. What happens if there's stuff going on the knee, like a total knee replacement, knee pain, a meniscal tear, anything going on with arthritis? That's the biggest one, osteoarthritis, bone on bone. Now that's going to also chip away at your balance strategies. And then lastly, your hip has its own reflexive strategy. So let's think about some of the things that could impact the hip. Again, it could be bone on bone osteoarthritis. It could be a labral tear. It could be a common one we're treating right now is trochanteric bursitis. It's when the outside of the hip, right on the hip bone, gets so sore and so painful to touch that it's really difficult to move around. So if any of those things are present, that also chips away at your ability to be well balanced when you're in an upright position. All right, well, now let's talk about body systems. What body systems are responsible for our balance? Um, I wish I can ask you guys, but I'm curious to know how many of you know that these three are the systems: the somatosensory system, your vision, and your vestibular system. Um, let's quickly jump into them so that I can give you some information on what exactly are these systems. So the somatosensory system is your brain's perception of what it's feeling through the skin and through the body. So the input underneath your feet, when you're standing on the ground, you should be able to feel the floor or the surface underneath your feet. And there's a lot of information that then gets sent up to your brain. Is it a flat surface? Is it an uneven surface? Is it moving? Is it still? All of that information is sent up to your brain from your somatosensory system. If you were to ask me, well, what is the number one diagnosis that really negatively influences or takes away from that feedback information when it comes to balance and standing and walking? I would say neuropathy, especially in severe cases, peripheral neuropathy. Patients tell us they can't even feel anything underneath their feet. So they can't really tell if they're standing on something firm or if they're standing on a pillow or a cushion. So that definitely starts to alter the way they move because they can't trust their senses anymore. So that's the somatosensory system. The next would be vision. This one, I'm sure you all know, we rely heavily on our vision to make sure that we don't fall and that we are looking at what we're stepping on. And if it's an uneven situation, that we are very careful with making the right body movements to clear each step and to make sure that we don't end up tripping and falling. So you can imagine if you start to lose your vision, now that's one less thing that you can rely on to help with your balance strategies. And then the last one is the vestibular system. And believe it or not, this one is extremely common. We get a lot of referrals from doctors saying, can you please do an evaluation on the vestibular system? This patient's experiencing a lot of vertigo and they're unable to stand and walk safely. So I happen to be certified in vestibular dysfunction. So we know how to receive these patients and do an evaluation to determine if they indeed have vestibular dysfunction and then we know how to put together a plan of care to improve that. So yes, these are the three systems that we want to make sure are being addressed and that they are as best as they can be. And if they're not, we want to make sure that we are going to the proper medical personnel to ask for their help to make sure that we're keeping this up and healthy and balanced and as best as we can. All right, so now we're going to talk about balance and when it starts to decline, right? There's a pretty significant population of patients here, or not even patients, just community dwellers here that have experienced a fall. If I were to be able to ask how many of you guys have experienced a fall, there would be a few on this call that would say, yes, I have. And if I were to ask, well, what was the cause of the fall? A couple of common things I hear is, well, you know, I kind of tripped over the rug. My toe got stuck on the corner of the rug and then I went forward. Another one I hear is, oh, I bent down to pick up the newspaper in the driveway, and being that the driveway is at an incline and I was bending down, I just kept going down. Another one is I stood up and started trying to take a walk, and then I got really lightheaded and I ended up falling backwards. And then the last one is I stood up and I wanted to walk to the left. So my body was already turning to the left to go in that direction. and somehow I ended up on the ground. So those are some of the common things that we receive here. So let's kind of look more into this. And to answer the question, when does balance start to decline? Typically, we see that happen after the age of 50, but the average age where we start to really see a decline is 65. Okay, well, it would be nice now to just kind of take a beat and to ask yourself, well, is my balance declining? How can I tell if my balance is declining? So here are some things that you can pay attention to when you stand up out of a chair. Do you feel like you need to take a moment before you start taking your first step? And I would encourage you to take a moment. If you're not, and you feel like you're unsteady, it's a smart idea to just stand still for a few seconds to kind of gather yourself. Make sure you're not dizzy, lightheaded. Make sure you feel your feet on the ground. Make sure you know if your body's moving or if it's still, and then you can take your steps, right? So that's one thing. Another thing with our balance, are we having a hard time getting up and down a curb? Do we have to like stop for a second and think about it and look at the curb and say, okay, how am I going to do this? That's another sign that something's going on with your balance strategies. Here's another one. You're on the golf course and you're walking around and you're thinking to yourself, wow, this is really difficult. Why am I having a hard time? I used to enjoy this and this was a piece of cake. Now I feel like every step I need to be a little ginger because I don't want to fall. That's another clue. A last one is, going to the grocery store. I need to hang on to the shopping cart. At some point in my life, that wasn't like an actual important thing. But nowadays, I need to hold on if I'm going to go down the aisles to get my groceries. And if I don't have that shopping cart, I might be in trouble. All right. Well, there's some good news at the end of this tunnel. There's some light at the end of this tunnel. What can we do to prevent balance loss or to recover it? There's a lot of different things we could do. I think we're just a society of not really going there with having a lot of, ample information. You really need to be your own advocate for yourself, and you really need to do your own research and find your own medical personnel and experts to really help you put it all together. Because I don't really see a lot of prevention happening in the medical arena. This is not a topic of, oh, I see you're losing balance and I know nothing's happened to you yet, but let's go ahead and get on top of it right now. And let's, send you to physical therapy so you can learn a preventative exercise routine to keep your balance well. We don't get that. I wish we did, because then we would be able to significantly reduce the amount of falls that we know are happening every single day in our community. But yes, you can prevent balance loss with a specific exercise routine that you would be doing on a daily basis. That's the first step to prevent any kind of risk of injury or risk of falls. Another thing we can do, if you don't know what balance exercises are safe and appropriate and effective, you can schedule a comprehensive balance and stability evaluation by a physical therapy doctor. When you reach out to your physician, you could simply tell them, I feel like my balance is off. I'm having near falls. I don't want to have a real fall. I'm having a hard time now going up and down curbs, walking the golf course, standing up and walking from sitting down. And I want to learn what I could do to improve this. And you could tell your physician, I'd like a referral to have my balance evaluated and see if they can teach me an exercise program so that I can prevent further balance loss or improve or recover what I feel like I've lost. And in most cases, doctors, physicians, they're very supportive. I cannot imagine why they wouldn't write you a referral to get this done. So another thing that we would encourage you to do, once you complete a physical therapy program, I know at Cora Physical Therapy, we're very big on teaching patients a home routine to empower you to maintain what you've gained. So you got to make sure if you're enrolled in physical therapy and you're nearing the end, you want to have discussions with your physical therapist about what can I do at home to. I know that I've been doing a lot of great work, and I know that I've been progressing, and I feel like my balance is improving, but I don't want it to regress, and I want to make sure I stay on top of it. At that point, you can ask your physical therapist, can you put together a home exercise program for me that I can safely do at home, and talk to me about equipment I might need so that you can help me find out where I can purchase these things and make sure I have them in my house. And then just make sure they clear you to be safe with some of the balance exercises that you will then be doing independently in your home on a daily basis. So this is where my heart is at, just helping patients, helping community dwellers maintain good balance strategies. It takes commitment to keep it where it's at. So if you're happy with your balance, you want to make sure that you know what to do to hold on to it, because the reality is, as we age, our balance strategies tend to diminish. And I wish I can tell you otherwise, or tell you it's a myth and it doesn't really happen, but that is true for every single human on this earth. As we age, our balance strategies will diminish. But we have the ability to slow that process down. And we also have the ability to recover what we've lost. And it's just a matter of you knowing where to go, who to talk to, and developing your support system so that you are staying on top of this and you're being your own advocate. And taking that commitment and that initiative is worth it, because then you won't miss out on opportunities to be with family if you're doing an outdoor event, spending time with your grandchildren if they want to take a walk with you, taking a leisurely walk with your spouse. Oh, here's another thing, and that middle top picture just reminded me. If you need an assistive device, well, first off, you may not even be aware if you need one or not, but we can help with that. Assistive devices, I've had mixed feedback from patients regarding them. And what do I mean by an assistive device? A cane, a walker, a rollator, walking sticks. Those are the top 4 when it comes to aiding ambulation, right? The one that patients choose when they're most compromised would be the walker, and then the rollator. The ones patients choose when their balance is, they just need a little support, that would be a cane. And then if they just need a little support when they're walking on uneven surfaces like grass or hiking trails or whatever, they can use walking sticks. But if you want to know my opinion on these types of ambulation aids, I'm all for them for a season. And the reason why is I'm always focused on things you can do to leverage yourself to prevent a fall. And the one thing I hear a lot is, well, I don't want to look like I have an issue. I don't want people staring at me. I am not disabled. I don't want my friends and family thinking there's something wrong. And when I'm out in the community with my friends, I don't want people looking at me like I'm disabled. And I tell them, I get it. There's that stigma that there's something wrong when you walk past someone who is holding on to one of these assistive devices. I get it. But here's what I counteract them with. Is it worth the risk ending up on the ground and having a serious fall where you can end up fracturing something that will now take months to recover. For me, give me that cane. I will use that cane because I do not want to fall. I don't want to have a risk of injuring myself. And as I'm assuming you guys know, when you fracture your hip, there's multiple studies that have shown that that significantly reduces the longevity of your life, your lifespan. So I'm all for prevention. I'm all for safety. And let me see what's next. So now is the question and answer portion. I really hope that I was helpful in sharing some insight. And I really hope you have questions for me. In the future, if you want to reach out, I encourage you and welcome you to. The phone number that you see here is our direct clinic line to our front desk. Joy is the one that's sitting there and she can answer your call. You can also email me directly. I would love to be of assistance and will do my best to answer any questions you send my way through email. And then if you want to learn more about our company, Cora Physical Therapy, you can go to our website, Cora Physical Therapy. We have multiple clinics across the villages and all up and down Florida and about 10 to 12 other states. We're a pretty big, successful group. So Lisa, I will turn it back to you.
Well, I just want to thank you very much. I actually used core therapy. I had 2 knee replacement surgeries, one in September and one in January. And I actually did use your one over at Tavares Plaza. So they were fantastic. So I'm actually walking proof that it works.
Yay.
And I did use a rollator.
Okay.
Recovery because I was afraid of falling. And even leading up to the surgery, I was concerned about falling. I guess I'm not vain, so I was happy to use it and I knew I needed it, right?
Right.
I'm just going to tell you a quick story. I had a call from a gentleman this week who was looking for placement for his father. And he said, my dad's 90 years old. He has a walker, but he parks it on the outside of his apartment. And he's had 2 falls in the last 2 months because he doesn't think he needs it in his apartment, right? And
Yes.
so, you know, if you're using it, it's really important to continue to use it, right? Even in all those places that you think, oh, my apartment's so small or my home's so small, I'm just fine. I'm going to furniture walk, right? But the last thing we need is somebody falling on their head because, like you said, life expectancy from the time of someone's fall, once you're 80, is 18 months, right? That catastrophic fall followed by a hospitalization, followed by a rehab stay, followed by outpatient surgery is significantly changes your life expectancy. So to prevent a fall, right, with just, again, therapy from you first, and then continue at home with the therapy that you've learned, right? Because I know you have an app even that people can put on their phone and they know the exercises that work for them makes a huge difference, right? So
Yes.
again, therapy is the way to go and continue to exercise and to learn those exercises. So just a little bit about how can physical therapy identify people who are fall risks? Can you give us just again a snapshot of that? What do you do if somebody gets a referral? And I actually took a picture of your slide that gave the exact verbiage to use with the doctor. So if I identify, I'm just going to say a family or someone who says to me, oh, I'm feeling very unsteady, I send them the information and they use the verbiage with their doctor. Their doctor says, now you go over to core therapy, get an evaluation. How would you identify someone as a fall risk? What would you do to identify them?
So we actually complete a comprehensive evaluation and we look at all the strategies and all the physiological systems and body parts that are involved with ideal balance. So we check strength of the legs, strength of the core. We check flexibility to make sure that the loss in their balance isn't because of limited ankle range of motion or limited knee range of motion or something going on with their posture where they're too forward bent. And so their center of gravity is more forward over their base of support. And so now they're at a high risk of falling forward just because of their posture. We also do a series of functional balance tests, and we record their numbers. If they're time tests, we also record other measurements, because these are the things that we track throughout the course of their plan of care with us. We're very big on making sure we stay true to their progression, their needs, and their plan of care goals. And in order for us to stay true to that, we do identify specific things that we remeasure over and over again until the very end. And the expectation is that their end results are way better than the results they came in with on day one. And I could tell you, I haven't worked with a patient here where there wasn't a difference. I would say 100% of our patients have shown a positive difference undergoing one of our programs here.
Yes. And I think one of the other things too, the vertigo, or if you've had like a little TIA, I know that in therapy, they were working with a lot of people that that have vertigo, inner ear issues, the vertigo, slight strokes, right? And that can really set your balance off. So again, I know that that's one of the things you're looking for, is just what have been your events leading up to this, right? What kind of medical conditions you might have, or medical events that have happened that might be leading to the identification of someone who's at a fall risk.
Right. And can I jump in real quick and talk about vertigo?
Yep.
So, in your inner ear is where your vestibular system lies. And there's like fluid in these inner ear canals, and there's these little hairs that go back and forth depending on what position your head is in, right? So this is the vestibular system gives the brain information on, am I upright? Am I laying down? Am I bent forward? Am I moving? Am I still? That is some powerful input. When the vestibular system is dysfunctional, you can't tell if you're moving or not. You cannot tell if your environment's moving. A lot of patients say, I feel like the room is spinning and I'm going to fall. Or they roll over in bed to try to get out, and then everything starts moving and they get nauseous and they feel like they're going to fall out of bed. And these are real experiences that elicits real fear and anxiety. And to treat the vestibular system, to try to get it, I call it recalibrated, is a big deal. If you are suffering from vertigo and your physician hasn't mentioned physical therapy, again, be your own advocate and call them up and say, I'm having vertigo. I'd like a referral to get evaluated by one who is certified in vestibular dysfunction, and make that connection so that when you come through and we determine that your vertigo is something that's treatable with physical therapy, we could start that treatment and clear that for you. And it's not like an extensive amount of sessions you need. In some cases, very short and sweet, just a handful of sessions and you no longer are dizzy.
Yeah, I actually suffered from vertigo, and I had that experience where the room was spinning and I was in bed for 3 days because I just couldn't even move. Every time I moved my head, the room started spinning, and eventually I had to have it corrected. But I had to wear a neck brace, excuse me, afterwards, just to hold it in place. Do we have any questions from the audience?
I don't see any. I've oh, here comes Nancy. So we'll ask her to unmute. Go ahead, Nancy. Unmute yourself.
Yes, I'm unmuted. This has been a really interesting presentation, so I thank you for scheduling it and Dr. Flores for speaking. But because she's mentioned the vertigo, could you explain a little bit about how is a physical therapy what you do to people who have vertigo, as to, because you're giving the impression that you might be able to help someone get it under control. And I was just wondering, how is that possible?
Absolutely. And I'm so glad you're asking that question, Nancy. So thank you. So there's 6 different causes for vertigo, and we're trained to identify what the potential causes could be based on a differential diagnosis as part of your evaluation. And when we narrow it down, if your vertigo is due to something called BPPV, which is having loose crystals in your inner ear, that is disrupting that connection between your brain and what it's perceiving from your vestibular system. We are certified in clearing out those loose crystals in your inner ear canal. We know how to do that effectively so that you no longer are getting dizzy because of that. The other common cause of vertigo that we could treat in a clinic setting is just called peripheral vestibular dysfunction. And that's basically just, what it is that connection again from the brain to the vestibular system has been disrupted. It could be one-sided. It could be due to having a serious cold or flu and a lot of nasal inflammation. And then when all of that subsided, what's left is that disrupted connection on one side. So every time you turn to that side, you can tell there's something off. You might get dizzy, you might feel lightheaded. Sometimes you could even hear a ringing in your ear, or you can feel really full on one side. If you have that as the cause of your vertigo, we can correct that too with corrective vestibular exercises. There's like a whole packet of exercises that we take our patients through to recalibrate that brain vestibular connection to make sure both sides are now equal. And on top of that, we include balance training to make sure when you're moving, you're walking and you're turning your head, all of that whole total body connection is as best as it could be.
Wow. Okay, thank you very much. This is very enlightening to know there is some possible, not cures, of something that maybe could
Some
be
good
done.
therapies.
Thank you.
Yep.
You're
Can you
welcome.
talk a little bit about vision and how vision affects people's balance? I know a lot of people that I work with have macular degeneration, glaucoma, or even they've had a trauma to their eye and maybe they are blind in one eye. So can you talk a little bit about how vision affects balance?
Absolutely. So, we have our in front of us vision, and then we have our peripheral vision. And all of that gives us input as to what we're moving into. So when we're walking, we know before we even get a few steps to a specific place what we should expect, right? Is it going to be flat ground? Are we transitioning now from a sidewalk to grass? Does it look like it's sloping upward? Just that the visual cue of knowing what's about to happen already starts the balance strategies to click into place. And then once we get to that place, we already know what we need to do to correct and make sure we successfully get through that point of time without losing our balance. So if you take away vision, it makes it really hard to know and to plan ahead of time. So now what you're ending up doing is relying heavily on your other senses. What am I feeling underneath my feet? What is my vestibular system telling me about how I'm moving and where my head is at in space relative to my environment? That's a lot, that's a lot because it's almost like real-time correction versus planning ahead to then have a strategy that you're going to take because you already see what's coming. So vision is so significant for balance. And that's why when you are working with, or when people that have fully lost their vision, they use a walking stick, right? That walking stick gives them the input as to what's to come. It provides them information before their feet even get to where they're going. So it kind of becomes their eyes, like, what am I about to step into? So it could be really frustrating. We've worked with patients that have lost their vision and they come to us and they're just really frustrated. And so we heighten their other senses. We take them through exercise training and different things to heighten the vestibular system, the somatosensory system, and teach them to properly use a walking stick. Oops, we can't hear you.
Sorry about that. Sorry about that. I was just trying to be quiet. So again, all these different things that you're talking about put people at risk, things that you don't even really think about. A past cold, limited vision because, again, cataracts, glaucoma, macular degeneration. If you're a diabetic and you have perhaps neuropathy, perhaps you've gone through chemotherapy and you have neuropathy because of that, right?
Right.
Perhaps even, an injury to your foot, right? So again, if you have diabetes and you didn't realize that you had an injury to your toes, right? And you may have a slight infection. If you have some vascular issues in your legs, and again, it's affecting your balance because you have inflammation, all of these things, even the flow of your blood flow to your feet, right, can affect balance. And having somebody like Cora Therapy really kind of go through that checklist. What are these different symptoms and signs and systems that could be putting you at risk for a fall? This is incredibly important. And it almost seems like that the doctors should be sending you yearly for a balance test, right?
Yes.
As they do a vision test or a hearing test, balance is going to, if you don't have your balance, so many things could catastrophically go wrong that affects life expectancy, right?
Absolutely. And I'm so glad you're saying that, because physicians don't order a yearly balance test.
Right.
That's really not a thing. It's like we just need to know for ourselves. Okay, it's been a year. Let me call Cora. Let me work with my insurance. Let me get my doctor to write a referral. I want my balance rechecked. It's been a year. I feel like we just have to do that for ourselves.
Yeah, I think it's important. And funny thing, when you're really meeting with your doctor, sometimes you're sitting the whole time. They don't know what your balance is. Maybe the person who took your blood pressure and your weight at the beginning did, right? Because they saw you walk from place to place. But sometimes your physician may not actually see you balance and walk, and right, or it's that moment in time, you've been sitting a minute and they think, oh, well, you're just a little stiff, but maybe there's really much more going on.
Right.
So again, I think it's really important that we're our own advocates for that too. And then once again, if you've gone through therapy, knowing, I often meet with families who've gone through therapy. They've spent an enormous amount of time at physical therapy at a building, then come home, done outpatient therapy, and they know they have the exercises, but they don't continue, right?
Yeah.
And they're sort of back where they used to be, and things are getting harder and harder. It is important that we continue those because, again, a fall can change everything.
Yeah.
And I really appreciate your giving us some of these, again, kind of putting all the systems in place for us and talking through this, because this is a really important topic. And, again, if you have Parkinson's, if you have Alzheimer's, if you have gone through chemotherapy, if you have syncope, right, blood pressure issues, if you have vertigo, there's so many systems, so many different medical events that you could have, medical underlying conditions that could affect balance. And it is really important to be our own advocate and to get therapy, so that because we have these underlying conditions, we are counterbalancing that with the therapy and trying to really be proactive in our own health.
Absolutely. And you mentioned Parkinson's. We are also certified with Parkinson's. There is a program called LSVT Big, and all we do with them is we challenge their dynamic balance by sitting big, standing big, moving their arms big, taking a step big, just really trying to make sure that the Parkinson's disease doesn't end up causing them to just kind of shrink into their own self. We need to keep things open. And so we've found enrolling patients in our therapy for the LSVT Big has been very helpful.
So how do people who have Parkinson's get in touch with you? Now, I was under the understanding that people with Parkinson's can continue to have therapy for their lifetime. And I'm not sure if that's correct or not. But if, let's say, someone does have Parkinson's, and I was just talking to a friend yesterday whose husband had a due to the Parkinson's, he fell, and now he's falling again at home. And I said to her, you know, you really need to talk to your husband's doctor and get some therapy ordered for him so that he can come back. He's starting to decline now, and she's going to have some procedure done shortly. How do people talk to their doctor about, I have Parkinson's and I want to continuously go to therapy, outpatient therapy if possible? What's the name of the program? And maybe on your next presentation that I know you're doing with us, we can talk a little bit about Parkinson's and getting therapy for people with Parkinson's, because we have thousands of people in the villages with Parkinson's, right?
Yep, we sure do.
So can you, the program again is called?
It's called LSVT Big,
Okay.
and it is a Parkinson's specific physical therapy program. And there are certified providers in several Cora clinics. And I happen to have 2 certified providers here at the Spanish Springs Clinic. Okay. You mentioned a couple things. So how does one go about getting physical therapy to get enrolled in this? Again, it starts with you initiating that conversation with the doctor and you telling them there's a physical therapy clinic that I know of that has Parkinson's programs and I'd like to be evaluated there, right? If they want their insurance to cover the physical therapy, then we're all governed by what those stipulations are. So there isn't anything, it's not like an accurate thing to say that you can have physical therapy for life, because there's insurance companies that just won't pay for that. Outpatient orthopedics is governed by functional progress. What that means is we need to be so good that every week we could document objective proof that our patients are improving functionally. And the moment a patient starts to plateau, now we're talking about empowering them to continue to do the therapy at home on their own. In some cases, it's a success win-win. Patients are confident they can continue doing it at home. They can continue making themselves better and maintaining those gains. In other cases, like Parkinson's, it's obvious there's no cure. How does that work? Well, what we do is we tell them, okay, now I hate to say it, but now we got to play the game. We're going to go ahead and teach you what to do at home. You got to really give it a good go for the next 30 days and we're going to involve your spouse or your caregiver to be the one to help you get this done successfully. In 30 days, give us a call. Let us know what's working. Let us know if it's not working. And if it's not working, then come back for a reevaluation and we can re-enroll you in the program again. When we do it that way, insurance appreciates it because they see that we've tried to work with the insurance to prove or disprove if the patient was able to do it on their own or not. And then they're okay with paying for another round of physical therapy. So that's one way that patients can get more access to physical therapy in the long run. But the reality is we teach them the LSVT Big program. And as long as they can do it safely and they have someone to help them, some of them appreciate being done, coming to the clinic, and they just want to do it at home. And we empower them with that and we encourage that.
Yep. And I think that's great. Again, I know you have an app and they can look at the app and say, these are the exercises that were specifically designed for me, and continue with the caregiver or the spouse. That's really great. And again, setting your alarm and saying, okay, at 10 o'clock each morning, I'm going to do these exercises. And then maybe at 4 o'clock in the afternoon, right? Just again, I'm going to break it into 2 sessions, but again, continuous. Parkinson's is one of those that, like you said, it's degenerative, it's continuous. You're never going to get better from Parkinson's. And so again, if you can get some really good therapy, go home with the exercises. And then again, if you see a decline that you just know has significantly put you behind, then certainly asking for more therapy again. But again, continuing at home at your pace, breaking it into parts perhaps. And again, having that accountability at home, right? Because again, anything we can do to prevent a fall is life-changing in the long run.
Yes.
So any other questions? I don't want to, any other questions that anybody has? So I think this has been, again, incredibly helpful. We look forward to you coming on the show again. I know that we've set that up for next month, and Maureen will be sending out invitations to, again, we have it on our website. We also will send out in our constant contact an invite to this. So those people that are interested in seeing part number 2 and part number 3 will know about the next parts. And this has been incredibly informative and I think enlightening for all of us. So I really appreciate your time. I know you're very busy, and Cora does great work. I think the therapists were very kind, very informative, made it very fun. And I saw them interacting with, again, everybody at all different levels. And I want to just congratulate you on, again, the company and being here and supporting the residents of the villages. It's making a huge difference in their lives. So again, thank you so much for this presentation, Doctor. And we look forward to hearing from you next month.
Thank you so much. It's a pleasure.
All
See
right,
you
have a
next
great
month.
day. All right,
Okay.
Thanks everybody for joining us. And again, we're going to have it in the events section on Wednesday. It's going to be the second section will be in April, and then the third one will be in May. And we'll get reminders out to everybody. So again, thank you so much for your time, and we look forward to hearing from you next month. Stay safe.